All right, let's get into this case, and I'll walk you through it like we're sitting down, just chatting about radiology, keeping it natural and relaxed. So, first off, when I look at this frontal chest radiograph, one of the things that really jumps out at me is the asymmetry between the left and right sides. It's pretty noticeable that the left hemithorax has this significant volume loss. You can see how the mediastinum is shifted towards the left side and the trachea is also deviated in that direction. This immediately tells me that something pretty significant is going on in that left lung, right? Now, as I move my eyes down, scanning the lung fields, I notice this multifocal lobulated opacification in the left lung. It's mostly peripheral, but there's still some aeration in the more central areas around the hilum. That's interesting because it suggests that while the process is extensive, it hasn't completely obliterated the airways. Also, the left lung base is kind of hazy, not clearly visualized, which makes me think there could be some pleural thickening or maybe even an effusion going on there. Switching over to the right side, something else catches my eye. There's a small irregular area of calcification just above the right hemidiaphragm. This looks like a pleural plaque, which in a lot of cases can be associated with asbestos exposure. That's definitely a red flag when you're considering potential diagnoses. And the right lung, it's actually hyperinflated compared to the left. This could be the right lung compensating for the volume loss on the left side. But, I'm also keeping in mind that there might be something else at play on the right side, even though it's less likely to be as serious as what's happening on the left. So, with all of this in mind, my leading diagnosis here is malignant mesothelioma. The way the pleural thickening, volume loss, and that calcified plaque are presenting, it really fits the profile of mesothelioma, especially if there's a history of asbestos exposure. Sure, I'm also thinking about pleural metastases, or maybe a primary lung carcinoma with pleural involvement. But those usually show up a bit differently. Metastases might be more nodular, and lung cancer would probably present with a more defined mass or nodule in the lung tissue itself. To dig a bit deeper and confirm what we're dealing with, I definitely go for a CT scan of the thorax next. This would give us a better look at the pleura and help identify any masses or nodules that we couldn't see clearly on the chest x-ray. And if we find something suspicious, a CT-guided biopsy would be the next step to nail down the diagnosis and figure out exactly what kind of cells we're dealing with. When it comes to managing this, it's definitely a team effort, bringing in the respiratory team, oncologists, and maybe even thoracic surgeons if surgery is an option. The treatment plan would really depend on what stage the disease is at and how the patient is doing overall. We could be looking at surgery, chemotherapy, or sometimes just palliative care if that's what's most appropriate. Now, thinking about what the FRCR2B examiners might throw at me next. 1. They might ask, what are some other differential diagnoses, and why do you think mesothelioma is the most likely? I'd explain that while pleural metastases and primary lung cancer are on my radar, the imaging features, like the diffuse pleural thickening and calcified plaques, really tip the scales in favor of mesothelioma, especially with that asbestos exposure in the background. 2. Another question could be, if this were pleural metastasis, what would you expect to see on the scan? Here, I'd talk about how metastases often show up as multiple nodular masses along the pleura, maybe with some lymphadenopathy, which would look different from the more uniform thickening we're seeing here. 3. They might also ask, what other tests would you do to confirm your diagnosis? I'd suggest a CT scan for a more detailed look and emphasize the importance of a biopsy to get a definitive histological diagnosis. Depending on what we find, a PET CT could also be helpful for staging. 4. Finally, they might probe into the management plan with something like, how would you manage this patient, considering the diagnosis? I'd outline the need for a multidisciplinary approach, discuss possible treatment options like surgery or chemotherapy, and the importance of having honest discussions with the patient and their family about the prognosis. So that's how I'd approach this case. If you found this breakdown helpful, Make sure to subscribe to Radiology Made Easy on YouTube. Leave a comment below if you've got any questions or thoughts, and definitely share this video with your colleagues. Let's keep making radiology something we can all learn and grow from together.